Occupational health support services. Here we will talk about the occupational health support services, their main aims and objectives. So the main goal of occupational health services in biomedical research is to provide healthier and safer environment to the workers working in these biomedical research areas. Either it's a diagnostic lab or it's a research lab. Now here we can accomplish a healthy or safer environment among the workers by limiting the exposure of workers towards the microorganisms or towards the biohazardous material. And here the limitation can occur, or it is possible only when we have the opportunity to detect these microorganisms, pathogens or biohazardous material. And the limitation, secondly, it is important when there is treatment against these pathogens. Now, by using this information, whether it is in the form of injuries or in the form of accidental spillage in the biomedical research areas, we can improve our biosafety measures by taking special precautionary measures in the lab working with the hazardous material. Now, healthcare providers who are providing healthcare, it includes principal investigator, biosafety officer, employers, as well as the workplace personnel. Now, work protection actually depends upon the collaborative work among this group of principal investigators, biosafety officers, employers, or of the workplace personnel. Now, supervisors and safety professionals, they must have the idea about the health safety providers, that what is providing in the occupational health services. इसके अलावा उन्हें वो टेक्निक्स आनी चाहिए कि कैसे वो अपनी लैब में पोटेंशियल हैजर्डस मटेरियल को आइडेंटिफाई कर सकते हैं. Now, principal investigator among this group is considered to be the expertise in his subject or is considered to be the master of his subject. So workers should be fully informed about the medical support services, and they should encourage the employers to utilize these health support services in the form of medicines, vaccines, or in the form of diagnostic tests. Now, services are offered in Pakistan, and it is accomplished with 3 laws. One is the US Department of Labor, then the patient confidentiality laws, and here we are following the 3rd law, that is the Americans with Disability Act 1990. Now, risk assessment plays a very important role. It is the main goal or the main objective of health support services. It actually defines the potential hazard and exposures that workers has to face during their working time. Now, contracted workers, students, visitors visiting the biomedical research areas, they must be provided with the occupational medical healthcare services as well. Now, if the employer is on contract, then institution is responsible. And if we talk about the visitors, then sponsors are actually involved in providing the healthcare services. Now, occupational medical health service can be provided by a number of ways. Either it can be house-based health service or it can be community-based health service. In-house means that if you are working in a diagnostic lab, then health service should be provided to the workers within the diagnostic lab. But if the lab is also affecting the surrounding areas, then healthcare service should be provided to the community covering the surrounding areas around the biomedical research labs. So plans are very important so that we can design special precautionary measures and workers can work in a healthier or in a safer environment. Now, medical providers should have a complete knowledge about the potential health risks that can occur in the working environment. For example, if the patient or the worker is dealing with a patient sample suffering from typhoid fever, then the worker should take special precautionary measures while handling the sample. So, medical provider must have a knowledge about the access to expert consultation as well. So prevention is very important. It is necessary to make the plans to improve the biosafety measures, and we have to make an effective approach towards managing the biohazardous material. Now, training of the workers is very important in order to educate them about the biohazardous material, that what type of exposures can occur in the lab, and your health can be at risk. So we must know the nature of the risk as well as the significance of the risk. For that, first aid box should be available in the organization or in the institution or in the biomedical research areas, क्योंकि अगर कोई भी एक्सीडेंट हो जाता है और in the form of injuries या worker pathogen से expose हो गया है, then first aid services should be there. Now, biomedical services for biomedical facilities working specially for the workers working in the lab, it must be evaluated every year. So, occupational health service providers should be provided with a better precautionary measures that has to be tested every year. लेकिन याद रखिए कि हम exposure को minimize कर सकते हैं. We can minimize the exposure of workers towards the pathogens, but we can't eliminate the exposure of the workers towards the pathogens, because they have to deal with these pathogens or the biohazardous materials in order to perform experiment on those materials, or it can be in the form of diagnostic test.